Welcome everybody to our apprenticeship bite-sized session number 3, and this session will be looking at understanding the pharmacy technician level 3 apprenticeship. So my name's Kate Long. I'm one of the apprenticeship leads at the Thames Valley and Wessex Primary Care School. My focus is on the Hampshire and Isle of Wight, the Wessex side of the school. I'd just like to introduce Kush. Do you want to introduce yourself?
Yeah, and I am Kate's counterpart, so supporting practices across the Thames Valley area. So that's the practices within Bob and the Frimley ICS areas.
And also joining us on today's session is a few other people. So we've got Claire. Do you want to do an introduction?
Hi, I'm Claire Sutton. I'm one of the primary care clinical learning environment leads in the Thames Valley and Wessex Primary Care School, focusing on Hampshire and Isle of Wight. And my professional background is a pharmacy technician.
Thank you, Claire. Becky?
Hi, thanks, Kate. My name's Rebecca Bastable. I am the pharmacy technician lead for NHS England workforce training and education within the South East.
Thank you.
I'm a pharmacy technician.
Thank you. And Philly?
Hi, so I am an apprentice pharmacy technician, currently been working in a dispensing practice for nearly 13 years, and I've been on the apprenticeship so far for a year.
Lovely, thank you. And welcome to everybody that's joining. This session is being recorded, so for those people that want to obviously access this after the event, then hopefully you'll be able to watch it at your leisure. So today we're going to cover expanding the pharmacy technician workforce in primary care, and also look at pre-registration trainee pharmacy technician, the overview of the programme. We're going to cover the entry requirements, what's needed for success, some of the funding opportunities, setting up the apprenticeship, and then some useful contacts and links. Kush, over to you. You're on mute.
So I'm actually going to pick on Becky, because we are so pleased that we have our NHSE colleagues on the call today, and I think to really bring in the passion behind why we need to grow this workforce. Becky, if I can bring you in just to talk to this slide.
Yeah, no worries. Thanks, Kush. Yeah, so as we know, the demand for healthcare generally is very high. There's lots of services that we're trying to deliver, and we really want to be able to pull on all of the workforce that's available to us within the NHS. And therefore, pharmacy technicians are a resource and a workforce that we can utilise to be able to help deliver all of those service needs, all of those models that are happening across primary care in both GP and in community pharmacy. So pharmacy technicians are really starting to get recognised for their role. There's been lots of changes, in particular the recent change to legislation around patient group directives, which will enable pharmacy technicians to be able to deliver more services. So I think it's really important that pharmacy technicians are being promoted and utilised within the primary care workforce. And setting up multi-sector training will give opportunities for the trainees to be able to get a wide range of experience and growth within their training across the 2 years. And there is a requirement for them to have dispensing elements within the 2-year course as well. So yeah, it's an exciting and a great opportunity to expand your roles within the pharmacy technician workforce.
Great, thank you, Becky. And as people are joining the call, just to remind you, this is a very quick whiz through the apprenticeship. So if you have any questions, please do raise them in the chat and we'll have a look as we go through. Just bring all of these up. So investing, as Becky's just said, investing in your PTPTs is a long-term investment to grow our own staff. Many PCNs have said, actually, Kush, we don't have a problem with recruiting, and that's because there are pharmacy technicians available. They work in the other sectors. Some have said they have a lot of difficulty recruiting. So some of it is geographical, and there are various reasons behind those sort of two extremes. But I think the point Becky's trying to make there as well is that it is important that in primary care we do grow our own workforce, that we complement the system. But also, if you think about other roles like the nursing associate role, registered nurses, the more that we're able to upskill these professionals within our settings, the more that's going to have a positive impact on your service provision as well. So this is a really interesting apprenticeship for primary care. Practices and PCNs can develop their own existing staff, as well as recruit into an apprentice role. And of course, all of this is sort of aiming towards meeting the NHS long-term workforce plans, where we're aiming to have a clinical apprenticeships targets of 22% by 2031-32, and that is a cross-party agreement. So that, you know, it's fantastic. The PTPT programme is a 2-year programme, so 24 months, and that includes an endpoint assessment. We'll come on to all of this. The programme is a mixture of work-based experience, so that's operational and patient-facing experience, and that's really important, whilst completing a vocational course. So they will go on training, and training will be achieved in different ways, and they will have that all-important work experience to demonstrate those competencies over the 2 years. The programme will enable the PTPT to meet their GPHC standards so that they can join the pharmacy technician register. And the programme includes a wide range on the curriculum. So some examples there: chemistry, microbiology, through to law, dispensing. This is really important for practice PCNs to understand, that competencies will need to be evidenced for dispensing. But also through to medicines optimization, reconciliation, and accuracy checking. There's a reason why that's in bold. We'll go through that in a moment. So, Becky, can I please bring you in to explain this wonderful slide around the range of tasks that a PTPT can offer?
Yeah, so I think often we get asked, you know, what can a PTPT bring to the workforce? What can a pharmacy technician, once they're registered, bring to the workforce and actually support within a primary care setting? And this is just a really small kind of snapshot of the different activities that a PTPT can get involved in, and then obviously with less supervision as they're registered as a pharmacy technician. And I have stolen this from another slide deck, so it's not my work. But, you know, they can be involved in drug monitoring, counselling patients on devices and medicines, doing consultations, doing medication reviews, obviously under supervision at first, and then kind of as they progress and become less dependent on the supervision and become more qualified, then they can do those unsupervised, but within the escalation requirements of the organisation as well. They could be doing statin initiations, running their own clinics, managing referrals to community pharmacies, doing medicines reconciliations for discharges and letters coming in from hospitals, you know, taking blood pressure checks. There's lots of hands-on that they can do with a patient, as well as the documentation elements alongside, you know, prescription queries and the such like. But there is a requirement that obviously that you do support that PTPT within the workplace. There is activities that they'll need to complete as part of their course. And there are elements of it that you need to make sure that you are training them competently within the workplace as well. So making sure that you've got appropriate processes in place, competencies that, you know, might be in addition to what the training is requiring you to do. But the world is kind of open to opportunities for PTPTs and pharmacy technicians within the primary care settings.
That's fantastic, because it's really enriching your PCN service provision and complementing the role of the clinical pharmacist. Yeah, brilliant. So there are entry requirements, of course, and they will slightly vary depending on the apprenticeship provider, but typically the individual will need 4 GCSEs or equivalent, grades A to C or 9 to 4, and that includes maths, English language, science, and one other subject. I have seen slight variances on this where there are some flexibilities, but ultimately, particularly with the maths and English, that will need to be achieved before the individual gets to what's called the endpoint assessment. It's important to say that there is a non-apprenticeship route to achieving this training as well. There isn't funding available for that route at the moment, so it's useful to therefore go over what the key differences are. The duration of the training is the same. The key differences generally tend to be around the eligibility criteria. So for any apprenticeship, the apprentice must have resided in England for a period of 3 years or more, or be on a residency scheme. They can be 16 years plus. So there's no upper age limit as long as they are working and on a contract. And this is important because I do still get managers he was saying, I can't possibly put my person on an apprenticeship. They left school 20 years ago. Well, actually, the average age of an NHS apprentice currently sort of hitting the mid-30s. So actually, you know, anyone can do an apprenticeship, providing they're 16 plus. So there are off-the-job training requirements that are currently set at a minimum of 6 hours a week. So that could look like attending a workshop. Some providers will have these 1 day a week. Some will be once a month. Some have predominantly self-directed online learning platforms. So quite often it's a blend of the both. But also the individual will be learning new skills whilst they are at work. So providing those are new skills and they're supervised and there's some documentation around that, that also is learning, and that can contribute towards this 6 hours as well. It's essential that the supervisor attends something called tripartite review meetings within apprenticeships. A supervisor is needed, especially an educational supervisor. We will come on to that. It's needed for this particular apprenticeship anyway, but for funding compliance, they must attend tripartite review meetings. There is in the new rules a little bit of flexibility around this, in that the person needs to have sight of what's gone on in those meetings. But from our experience, the more the supervisor is able to attend those, they're only every 10 to 12 weeks, the better quality experience that individual has, because you as a supervisor knows exactly what's going on, more than what you see on a screen in front of you. You can actually have a conversation, but also you can see what the plan is coming ahead. So those meetings are important. The apprentice must be employed under a contract and be able to complete the apprenticeship within the time and duration of that contract. So whilst this apprenticeship is 24 months, we all know that life can happen, sickness, maternity, various scenarios. So just have a think realistic about what extra time you might need on in addition to that 24-month contract to enable that individual to get through the programme. But also if they have a visa, to make sure that that won't expire before the apprenticeship duration. This last point is particularly important in that the apprentice must have access to a dispensary environment. Becky or Claire, can I just bring you in on this point, if there's anything that you think would be helpful to clarify for the PCNs?
I would just say that in terms of the dispensary environment, it's really good to partner with your community pharmacy colleagues. I know lots of PCNs already have those relationships, and actually you can use reciprocal placements. There may be things that their community pharmacy technician apprentices will benefit from coming to you guys within the PCN. So it's really important to build those relationships and give a much richer experience for the PTPT that they can bring back to the workplace as well.
Thank you. So some of the ingredients for a successful apprenticeship, there are many, okay, but we've selected our top 4. And once I've gone through these points, I'm going to bring in the wonderful Philly, who's actually doing all of this. So we think it's really important that you carefully select a training provider. You're in a relationship with this company for at least 2 years, so it's really important for you to understand how they work, what their training delivery looks like, how does that fit with your business model, but also really importantly with your learners training style. So what's the best fit, and what are their outcomes? You know, how have they performed in terms of past distinction grades, you know, however it works within this apprenticeship programme. An educational supervisor. This is where I'm going to bring in Becky. So if you could explain this aspect, please.
Yes, I guess it's really important that as an employer, you understand the requirements of an educational supervisor, which needs to be a registered pharmacy professional, either a pharmacist or a pharmacy technician, who actually has the capability and capacity to be able to support that trainee over the 2-year programme. They need to make sure that they meet the GPHC requirements for tutoring and supervision, as well as the requirements of the provider. And the provider themselves will deliver training to the supervisor to showcase what they need to be able to do over the 2-year programme. They need to be able to meet with that trainee regularly, and we would say a minimum of every 4 to 12 weeks, depending on rotations and placements. But it's really important to stress that they need to be accountable for them for a minimum of 14 hours a week. And that doesn't mean that they need to be beside them side by side for 14 hours, but they need to be accountable for them, and take responsibility for that trainee over the 2-year programme. The role of that education supervisor is to be able to support that trainee, identify if there's any trainee additional support needs, but also to be able to sign off the job hours, which we'll come on to be able to sign off assignments, potentially do witness accounts. There is a lot of activity within their portfolio over the 2 years that the educational supervisor is responsible for. So you need to make sure that that person has capacity within their workplace to be able to support that trainee.
Thank you, Becky. And Claire, if you could just speak a little bit about the experiential learning opportunities by way of placements.
So this can really vary depending on your area and what relationships you have already. But the more placements you can do, the better in terms of getting that well-rounded training experience. So within the PCNs, actually working with some of your other professionals as well, so not necessarily leaving the PCN, perhaps working if you've got some advanced practitioners, so that they can see the medicines reconciliation or optimization in that aspect. Or you could have, if you've got links with your social prescribers, where they're going out into the community. So although they may not be directly pharmacy, actually there is a lot to learn from these roles, and that can be brought back into the training. There is, as touched on before, the multi-sector placements as well, which the more sort of formal placements where you would link with perhaps a community pharmacy or with your local hospital to get the dispensing elements completed and the final accuracy checking. Again, as I mentioned earlier, these can be reciprocal, or if not, some places will take it in a non-reciprocal way as well. So I think the main thing to say is build as many relationships as possible to get those placements out there, because people want the same back for their trainees. So yeah,
Absolutely.
build relationships.
Absolutely. And this is the time to do it whilst the individual's on the training, and that appreciation of what it's like across sector, across professions. And of course, across Hampshire, Isle of Wight, the Bob area, Frimley area, you do have some leads within pharmacy that can help you. So Claire Sutton, Subia Israel, who's on this call, and then colleagues within Bob as well, just to help you with making those connections to other parts of the system. And quite often they have really good ideas about things that the individual might benefit from. So Philly, please can we bring you in to share your experiences so far? And you said you're a year into the programme.
Yeah, so currently my training provider is Buttercups. Like I say, I'm a year in. I have a really, really good work training supervisor who is a pharmacist, and I also have a workplace facilitator who is a pharmacy technician. So I'm really lucky. And I have been in a dispensing GP practice for, I think it's about 13 years now. We formed our own PCN when we went through another merger, so then we could get the funding for me to do the apprenticeship. I would say you need a lot of time. I'm very lucky that each week I have an hour morning slot with my pharmacist, so we get protected time if there's any questions, if there's any work that needs marking, if there's any work she needs to set me. Off the job training, which is actually like you say, new learning within your working hours. It's really important to log that. It took me a long time to kind of get into the habit. You have two portals that you use, so something called the Beehive, which is where you do all your reading, and you do kind of multiple choice questions. You have virtual classrooms, so for every module you'll have at least one virtual classroom. I can't remember offhand how many modules there are in total, but within a module, I mean, you can have hundreds and hundreds of questions, and there's a huge amount of learning that has to be done. You also then have your one file, which is then where you log all your off-your-job training and any additional tasks that need to be done. So yeah, it's very full on, and like I say, I work in a dispensing practice, so trying to amalgamate everything, because it taken me a little while to kind of get into, but yeah, I'm definitely getting there now.
Brilliant, Billy. That's really, really helpful. What would you say if you had like a top tip for other people considering this apprenticeship program? Any particular top tip?
So a couple of top tips would be definitely find a pharmacist who is passionate about upskilling. So I had 3 pharmacists who I could kind of ask to support me along this journey. One who didn't really understand what a pharmacy technician did, one who wasn't really, not keen or obstructive, but just didn't really understand and wasn't really worried about upskilling. One who was fairly new, so it wasn't really fair to ask, but luckily the pharmacist who I've built and worked on that relationship since we merged is really, really keen on upskilling, because she also works in community pharmacy as well. So she sees what pharmacy technicians can do outside of sort of, general practice, which is really, really important. Definitely make sure that your workplace understands you need that protected time within work. That's kind of the contract that they sign for you to do the apprenticeship. And again, you have to be quite firm. I think when you're a bigger organisation, you can kind of get lost down the pecking order, but I think it's just making sure that you're really firm, that you do need that time. And just keep your head down and work hard.
Yeah, that's it, exactly. And that really nicely makes the point on the slide, which is around honest conversations. You're trying to work, you're trying to study, you're trying to have a life, things will get in the way, and it's just about being honest. So just for the sake of time, I'm going to move on, but thank you so much, Billy. That's actually really, really valuable. Thank you. So just a couple of points around funding. So Becky, I keep picking on you today. Are you able to say a few words about this new direct patient care category and where this role might fit in?
Yeah, so the ARS funding, so the Additional Roles Reimbursement Scheme, has been running for a number of years, and since 2021, the pharmacy technicians have been included as part of that scheme. At present, there's just over 2,000 full-time equivalent pharmacy technicians that are employed under that scheme. The ARS funding has been broadened to now include pharmacy technician apprentices. That's not to say there's extra funding, it's just that the roles under the ARS scheme now include pharmacy technician apprentices. So that means that you can utilise that funding to be able to employ a PTPT within your PCNs. Your integrated care boards and also, the likes of Kush and Kate can help to support with this as well. But it's really important that you do look at that contract and what it means for direct patient contact. But yes, it does mean that you can utilise your ARS funding to be able to employ a PTPT now within your PCN.
Brilliant, thank you. And we put a link in there to the actual paragraph within the contract if you want a bit more information. And then Kate, just some information around levy.
Yeah, so if an employer is a non-levy payer, so that would be if your practice has a pay bill of less than 3 million, which is the norm. Most practices are non-levy paying organisations. Some of the larger PCNs that work with all of their practices together as a PCN do pay the levy, but as a whole, rule of thumb is the majority are non-levy payers, which would mean that your practice would need to pay 5% of the course fees, and the rest, the 95%, would be paid by the government. However, if you contact Kush or I, we may be able to source levy transfer from neighbouring organisations, because the levy expires. So a lot of neighbouring organisations would rather transfer or donate their expiring levy to primary care to support apprentices. So if you email Kush or I, we might be able to help you source levy transfer, in which case all of the fees would be paid by that levy transfer, so you wouldn't have to pay the 5%. But we do need a little bit of time to try and source that, couple of weeks at least.
At least, yeah. So this stuff has to kind of be set up before the person enrolls into the programme, so it's important to allow some time. Speaking of which, how do you go about setting up the apprenticeship? So number one, navigate the training providers. So to the question that was in the chat, also there is a link that we've created locally. We've looked at the training providers that are on the higher level NHS Salisbury framework. The framework has sort of various quality vetting, if you like, that they've already done, and they have a higher level framework of selected providers that are on that framework. We've looked at what's practical in terms of the southeast, and there is a link there to that to that table. So that's a local training hub list, but you have got the email address there as well. For NHS England guidance, because they will have that bigger picture understanding. If you are recruiting to a new role, timelines are so important with this. Okay, so once you've selected your training provider and you understand how often they have a cohort start date, I would allow about 6 weeks for their onboarding process, and that simply means, I say simple, it means a number of paperwork. So submitting their certificate evidence of their entry criteria, proof of residency, setting up your digital apprenticeship service accounts and the funding arrangements. And of course, before that, you will have your own recruitment timescale as well for interview appointment. The person may be needing to give notice of leave to their current employer, so just a realistic idea of when they're actually going to start the programme. If there are links there to a sample job description and an advert for you as well, created by colleagues within NHS England. For existing staff, sometimes I've seen a model where people are working in a dual role, so admin and dispensing. It's important that they're moved into a trainee apprenticeship role. So once that's done, they're good to go into their apprenticeship programme. And then you've got some links there for setting up your apprenticeship service account and your levy transfer. So in the last minute, we have some useful links there for you in the slides. We will send the slides around. If you registered, I've got your email address. If you didn't, please just pop your email address in the chat and we'll get that around. And if you're networking with other colleagues, we will be uploading these onto our website as well. So we have got some future, 2 more sessions coming up on management, leadership and digital quality as well. So please do spread the word about these sessions. I know I'm okay for time. If others are okay for time, and if anybody wants to come onto the call and ask questions, please do so. Otherwise, have we answered all the questions?
I think we've gone through the ones in the chat. Yeah, I think we've gone through those.
Perfect.
Thanks, Kush. Yeah,
brilliant. Okay, and some offers of help there as well. So that's fantastic. So thank you so much, everybody, for joining us today. I'm sure you'll hear more about this role in the coming months. It is definitely one of the higher ones on the agenda. So any questions for locally, you have Kate, Claire, Subia or myself. And from a national perspective, you have Becky, who has a wonderful team for each location as well. So if there's nothing else, thank you very much.